At this time, I'd like to call our meeting to order. This is the Central Midlands Regional Transit Authority COVID-19 Ad Hoc Committee, Subcommittee. And we do have a quorum. And the first item on the agenda today will be the adoption of the agenda.
I move that we adopt the agenda.
And I second that motion. Any discussion, questions? If not, let's vote. All in favor, let it be known by saying aye.
Aye.
Aye. Okay, so the motion carries. Next item on the agenda is the discussion of items.
We're going to adopt the minutes from September 18th.
Hold a minute. I tell you what, sometimes, okay. All right. The next item on the agenda is the adoption of the minutes from September 18. That can be found on pages 2 through 5. Can I get a motion?
I move approval of the minutes as distributed.
And I second that motion. Any discussion or questions? If not, we'll take a vote on it. All in favor, let it be known by saying aye.
Aye.
Aye. Okay, so the motion carries. Item number 4 on the agenda, discussion and action items, and that will be led by a cadre of people. Mr. Corey Gangon, Joe Sanchez, Leroy Deschamps, Pamela Mayo Reed. So I'm going to ask Leroy, you want to start with this? I guess we'll start with the item number 4A, which will be...
Yes, sir, Mr. Chair. What we will do, if it's okay with you, is we'll go ahead and have Mr. Sanchez give us an update on operations, and also to myself, I'll give an update on COVID-19 and now testing, and we'll also have update us and talk about the policy. And also, we'll have Ms. Tanisha Gibbons. She will be updating us on some cleaning issues and also during this process. So
all right, sounds good.
We'll have Mr. Sanchez lead us off here.
All right. Good morning.
Morning.
Good morning, everyone. Colonel, Ms. Booth,
All right.
board members. So, after the Lovelace testing, all the employees tested negative. Everybody came back with a negative test result. We also had we had one of our COVID positive operators return back to work after furnishing a negative test result. So that's good. We still have a couple of employees that are out, and we're waiting for their quarantine time to lapse so that way they can go for retesting, which is great news. I want to touch on the food service. It looks like for September we've did a total like about 305 food service deliveries. So we're averaging about 15 food deliveries a day. And that's an average. Some days it could be more. So it's looking pretty busy for the team over at TCS, with Jem and his team. They're doing a great job. I haven't heard any negative feedback regarding the food delivery service, which is great. But as we get that communication and that feedback in, we address it immediately. Regarding the service out, we haven't heard anything negatively regarding customers refusing to wear their mask. We do encounter the occasional passenger that does not want to get off at the end of the line, but since we've been doing this for a while, the resistance has been down to a minimum. They refused initially, but as soon as we call for a row supervisor, an ops supervisor to go to the scene, they get off the bus and they get on the next bus to take it back across town. Let's see here. I know. Okay, so Tanisha's going to talk on the vehicle cleaning, so I won't address that unless you will like me to address an update from our previous meeting.
I'd like to ask you a quick question.
Sure, absolutely.
How many meals you said we were delivering per day?
It's an average of 15 per day. On some days there's more.
Oh, okay.
Yeah.
Okay. Okay. Thank you.
15, 1 5.
Okay, thank you.
Yes.
Well, that sounds like a significant drop in what we were getting before, or were we hearing, when we were hearing around 90, was that per week or?
Yes, that was an average on weekly.
Oh, weekly, okay.
Yes, yes.
Oh, I didn't understand. I thought that was daily.
No, sir, no. So for September, it was a total of 305. And it's an average of 15 per day. Like I said, some days in some cases more. And Jem's team is handling that very well. He has been receiving feedback indicating that they might send over some more. So that's good. That's positive.
Mr. Chairman?
Yes, let's move.
Could we just have the report on cleaning from both Mr. Sanchez and Tanisha kind of together so we can hear all of what we need to hear at one point in the agenda?
That sounds good to me. I think that would be a great benefit.
Okay.
So, okay, go ahead, Leroy. Have you finished, Mr. Sanchez? Go ahead, Leroy.
Okay, I want to just reemphasize Mr. Sanchez about our COVID testing screening that we had last week on September 22nd and 23rd. We had a total of 55 staff members that were tested, and all the results came back negative. So that was good news for us. And just to kind of reemphasize, we'll be scheduling another testing October, and then the third one will actually be like December 1st and 2nd. I moved that one there because of Thanksgiving. Again, if for some reason we have to move it up, then we have that flexibility also. But just want to reemphasize what happened last week with the 55 staff members that were tested and all negative results. So that was great news, and we just keep reemphasizing and making sure that we're doing everything here as far as making sure the building's clean, fogged, or our fleet, which they'll talk about here in a minute. But that was a great news on the COVID testing that we did on last week.
That is
And
good news.
yes.
Thank you.
Okay.
Thank you. Anyone else has a question? I would like to ask Mr. Sanchez one question.
Sure, absolutely.
To your knowledge, has RAP there at any time asked a person who had tested positive to continue to work?
Negative. No, sir. Someone testing positive would not be asked to continue to work. And to my knowledge, if that happened or has occurred, to my knowledge, I am unaware, Colonel.
Thank you, sir. Go ahead, Leroy.
Okay. At this point, we can go into talk about the vehicle cleaning.
Yes, let's do that, because
Yes,
then we
sir.
don't hold Mr.
Mhm.
Sanchez up for the rest of our agenda.
That'll be good. Yes, sir. Go ahead.
All right. So I guess I'll lead it off. So previously, the last time we spoke and discussed the cleaning of the vehicles, I had overstated by saying every Wednesday the fleet will be cleaned, because the team would not have the manpower to do all the vehicles on the same day. What we have now is we have our subcontractor, which is the CBS Capital Building Services. We've implemented a tracking sheet now because it wasn't keeping track thoroughly regarding the buses that were being done. He did verify and he did confirm that he was fogging the vehicles. However, we created a tracking sheet that has the fogging as a title, fogging tracker, totally separate. So that way it's 100% clear the units fogged versus um, detailing falling with fogging falling under that wording of detailing. So uh, going forward, and as of September 23rd, 4th, and 5th, which is Wednesday, Thursday, and Friday, the fleet is completely fogged. We get those fogging tracking sheets turned in the following Monday for the previous week that was fogged. And that's an ongoing tracking mechanism that we've informed Mr. Ivory of CBS to supply. So we give him the documents. He turns them in on Monday.
Mr. Chairman,
Okay.
in
Yes.
addition to the fogging, could he clarify? I believe we got some information that some of the cleaning was not being done on schedule, and I didn't understand that to be just fogging. So maybe either Mr. Sanchez or Tanisha could give us information on that.
Okay. Go ahead.
Yep. So the inconsistencies, and those were the hiccups that we encountered because of some, I guess, some contractual conflicts between our current subcontractor that cleans and provides that service, as well as our other subcontractor, TCS, as items were bidded and were not awarded. But so those issues were causing a lapse in what was getting done, who was doing it, who was not going to do it. So in order to just, erase all those inconsistencies, we established Mr. Ivory of CBS, is going to fog and detail the unit, as well as TCS doing their part at the end of the at the end of the operator's route when they come in to go into the service line. But as far as, like I said, the fogging was completely done by Mr. Ivory of CBS. He had a poor tracking system. We created a tracking system that's more efficient for him to use, and that's what he started using as of September 23rd. But the inconsistencies and what was not getting clean, and that was a bumping of the heads between the two subcontractors that we have resolved, that RATP dev executives have it resolved.
So, Mr. Chairman, if you don't mind, if I may add,
Yes, sir.
just for the committee's clarity, we have a contract with RATP Dev to do service line detailing work, and in that contract, fogging is one of those responsibilities. It is up to RATP Dev to figure out who does the work, and and it's not a concern of the comment. So I just want to make sure that that's clear, that there is a contractual obligation of RATP Dev to do the fogging of the buses as well as the detailing. They've opted to subcontract out that work. So it appears that they've resolved some of the subcontracting conflicts that they had, but I want to make sure that there was no conflicts between the contract that the comment has with RATP Dev on this matter.
Okay.
Mr. Chairman.
All right, yes,
So my understanding is that what got cleared up was that CBS is now doing the fogging and detailing that weekly work, and that TCS is doing the end of route cleaning, the daily cleaning of every bus. Is that what I'm to understand?
Yes. Yes, that's what they're doing.
Okay.
Okay. So the discrepancies seems to have been an understanding that TCS pulled flogging out of their original end of day cleaning, and that went underneath detailing in the detailing sector. So basically, since the detailing was having a problem, the fogging fell under that detailing department, and that's how we missed fogging the buses. Because I know that the percentage of buses that were fogged was very low. So
yeah, and per our contract, section Appendix A, Section B, subparagraph 18, about the fogging is a detailing. It's under the detailing section of the RATP Dev, the contract, and
right.
With our change order number 1 that was approved by the board, they're supposed to be detailing the buses weekly. We pay for 2 of those detailings, which includes the fogging, and RATP Dev in their contract is responsible for paying for those detailing, which includes the fogging. So at the minimum, 104 buses and vehicles need to be detailed and fogged weekly.
Okay. And I know they've resolved the problem now, but how many did we have? Just so we can have a comparison, how many buses were actually fogged? And then we'll move on to the next item.
I'm sorry, hello, Colonel Lee, Ms. Moon, it's Tanisha. Before the month of September, before September 23rd, it was not tracked properly or was not tracked at all. So in the month of July, we had 59 vehicles detailed, and in the month of August, we only had 98. So the number went up, but it's still not what it's supposed to be at the 104.
Okay.
And Tanisha, to be clear, is that weekly? They're 98 weekly?
No, that's for the, no.
Okay, so in essence, there should be 416,
Entries.
There should be 416 detailing and foggings a month. So if only 98 was done out of 416 detailings and fogging, that's only 23% of the foggings and detailing was completed. So
are we clear about how much of this problem is a problem of tracking and how much is a problem of actual work getting done?
It was, this is Joe. It was the problem at the end of the day was the tracking. Mr. Ivory stated that, yes, the vehicles were fogged, but his tracking of the vehicles of fogging was not up to standard. I mean, he just wasn't doing it at all. So that's why we created the sheet, so then that way we know every week, every single bus is getting fogged unless the vehicle is off-site. For example, we have one, I believe is a trolley, and another one is getting wrapped, and that's about it. But
so if I understood,
yes.
if I understood you to say that the the tracking has been initiated on September the 23rd. So really, we just have about 1 week of the of documenting the cleaning and that being tracked. We only have only 1 week of that data, and I guess the data, John, is that unless we have some record of the work being done, then you're confronted with a bill for a service that you don't have documented.
Yeah, so the data that is being reported to us by RATP Dev is what we're going off of.
Right.
Since it's self-reporting, and then of course Tanisha and Leroy does contractual audits to see if what's being reported is truly accurate or not.
Okay. So I'm trying to keep these numbers in my head, but what I guess what I'm saying, what I'm hearing is that for example, the 104 that Mr. Sanchez reported on, if that's just for the week that they've been tracking, then we really are pretty much on target for the 416 for the month. Is that, I mean, if that continues at that pace, then we would be on target?
That would be correct.
Good. So
Okay.
I know you all have to iron out what happens with the previous, but I just wanted the assurance that what we're doing now will keep us on target, and I'm glad to hear that.
So basically what happens is within a 7-day period, they would need to ensure that they're spreading out 104 vehicles between 7 days to meet that 416 target a month.
Okay.
Right.
Mm-hmm.
Okay.
So, sounds good. Mm-hmm. Well, it looks like John and Mr. Sanchez, it looks like the problem is being solved, and some encouraging news. So, is there any other discussion on this?
Can I just have one more? I just wanted to comment on one more thing. I wanted to say how much I appreciated all of the APTA data, John, the reports that you included in our packet, because it gave me a chance to see what was being recommended and what the feedback was from studies of riders, to see how close we are coming to the things that across the board have been deemed to be effective, both in terms of health and safety and in riders having confidence in us. I had just 2 comments, and I'm on page 23 now of that data that we got.
Ms. Lou, I don't think, have we gotten to that yet? Have we finished? We hadn't finished.
This is related because the question I had was, one of the items they said was effective was A/B system for employees, and that's what I wanted to ask Mr. Sanchez or John what that means and whether that's something we are doing.
I don't even know what page you're on. I wish we
23.
I know. Can we finish this section up here first and then move on?
Well,
to that one?
I didn't want to leave this. I didn't want to not ask Mr. Sanchez while he was here if that was something he needed to answer about staffing.
Okay. Go ahead and answer, Ms. Sanchez, if you follow that.
Yeah, which I'm on slide 23.
So yeah, page 23. Basically, some transit systems have an A/B system, meaning that a group A works on these days and then group B works on these days to reduce the number of people that are working to prevent the spread of COVID.
And I just wondered if that was something we were doing or not. That was just my question.
Colonel Leak?
I have to see.
Yeah. Go ahead.
Give me 1 second.
I wanted to get clarification because my minutes. I wrote down it's 104 per month, and it's supposed to be 416. Is that correct?
Per week.
Supposed to be 416. Isn't that right, John? Yeah.
So 416 per month, 104 per week.
Got it.
Right.
Okay. Just checking.
So what we have those thermal scanners that check elevated temperatures prior to the operators go out on route, right? But as far as having separate shifts, A and B, let's say A shift is working from 4 to 12 or 4 to 1, and then B shift is coming in from let's say 12:30 with an overlap all the way to 8, and then you have your closing shift that's going to come in, let's say at 3:30 to let's say 12, 12:15. No, we don't have the
not doing that kind of alternate A and B shift. That was just for my own information. It wasn't that I was saw that as a requirement, just that I was interested in whether we were doing that. Thank you.
Yeah, we're looking towards the scanners. Every morning, without fail, the operators are checking their temperature, and I'll dispatch when an operator comes to the window. Tyrone, our AM dispatcher, normally he would get up and he'd just look just to confirm that the temperature is within range.
Right.
We haven't experienced yet what an elevated temperature alert sounds like, but I think everybody in this building knows when somebody's not wearing a mask, what that sounds like. So the good thing is we haven't experienced that alarm yet.
Good. And I wasn't concerned about. I mean, this data that we got talked about temperature checks for riders, but this committee decided that we did not want to get into temperature checks for riders. But I'm appreciative of our doing that for our drivers, just as one indicator, because we know that people can have a normal temperature and still be positive. So we're just doing. I understand the difference in that.
Yeah.
Thank you.
Okay.
You're welcome.
Okay. Now, Mr. Sanchez,
Yes, sir.
are you leaving now?
I am not, unless you want me to be excused.
No, well, I don't.
No, I just didn't want to hold him up. I didn't want to.
Ms. Moon, let me clarify this. What I'm hoping somebody from, some representative from RAPBEV will be able to stay during the entire meeting, because we have various questions that that will require your input, if you can.
No, that's
so.
Fine.
You agree with that? Okay.
I agree. I mean, I've been on all the way to the end of every one of these meetings I've been on.
Well, thank you. That's what I want to hear. But thank you. All right. So next, if no further discussion on that item, we would move to item B. Might have hit on portions of it, but anybody wants to go through page 19 through 56 and give us some more? Unless you go ahead. Who wants to do that?
I'll take on this one, Mr. Chairman and members of the committee. The purpose of just including this APTA information is starting with page 19. They've created a health and safety commitments program. Basically, it's more public relations campaign to let people know that we're being safe and we're going to keep you safe when riding public transportation. And we've signed on to be a part of this program. And once we get, and we'll be working with our marketing manager and our marketing consultant on how we can implement the recommendations in the toolkit. Include basically putting the seal on our materials, advertising, continuous advertising to the community that we're being safe. We're cleaning the buses. We only want people to ride for essential travel only. We want people to wear their face coverings, covering their nose and mouth. It's just more of a warm and fuzzy communication piece to just help rebuild transit ridership in a safe manner. Because there's still concerns from people and even from the media that are alleging public transit is just a cesspool of disease during this pandemic.
Mr. Chairman?
Yes, ma'am. Go ahead, Ms. Moon.
Well, I would just say again that I thought this was really excellent information, and it gave me a way to kind of cross-check what they were including in their program with what I'm aware that we're doing, and it sounds like we're doing a lot of the right things to both be safe and also to reassure riders. I did notice the post that they used, and so by our signing on, will we have the choice of whether we want to use some of those in our buses? Is that what that will let us do?
That is correct.
And I thought some of those looked excellent, so I hope we'll have a chance to about, or not at this meeting, but just that we'll be looking, the staff will be evaluating whether we want to be putting those in our buses and how. But I appreciated this, and I appreciated the being able to learn from the surveys that have been done across the country on rider feedback too.
Definitely.
So thank you.
Very good. Thank you. Very good. Okay. Anything else, John?
That's all I have.
Section?
That's all I have, just for information for this committee, because I know Mr. Huggins has made comment. He wants to make sure everything that we're doing related to COVID-19 activities are in alliance or in alignment with what other public transit agencies are doing. So this kind of gives you that perspective that we continue to actively be engaged. We also participated in the survey with APTA on the return to transit component as well. So our results are included in there.
Very good. Very good. Okay. If there's no other discussion on that item 4 Bravo, we'll move on to 4 Charlie. Proceed. Pages 57 through 62.
I'll take on this one with Leroy's assistance, if you don't mind, Mr. Chairman.
Go ahead.
When the committee adopted the COVID-19 operational policy that was also ratified by the board, every 3 months, this policy just needs to be reviewed. So I just reattached it for the committee just to review and see if there are any things that need to be changed, or if there is any feedback on the operational nature of this policy, just have a general discussion so it can be reported to the board that this policy was reviewed. Because as you know, we adopted this on June 5th.
Mr. Chairman, I didn't notice anything that I would think needed to be changed, and it seems to me that as long as we are operating under an emergency conditions as announced by the governor, that I don't see a need. I think it seems appropriate for us to continue to operate under this policy.
And also, Mr. Chair, like Ms. Mood was just mentioning, the governor just extended his state of emergency again for 15 days. That was done on September 24th. So I know that's been a big focus of ours to make sure that whatever we're doing is aligned with that. We just wanted to make sure that the committee and all of the staff here know that that had been extended for another 15 days.
All right. Very good.
So we don't need to take any action on this policy, or we just need to let the board know that we've reviewed it?
That's correct. I do want to just add that while there was an opportunity for a phase 2, we have not felt it was safe to implement phase 2 to allow standees on the buses. So we're only still allowing the buses to fill up to the maximum seating capacity. We are continuous in discussions with RATP Dev just to ensure that buses are not overcrowding or that we're not exceeding the maximum seated capacity. I do want to bring to the committee's attention, however, that we have gotten some requests as well as some calls about the feasibility of going back to social distancing on buses, which, as you know, if we did social distancing on buses, that would reduce capacity by 50%, which would require us to put more buses out on the street for those popular routes. Pam, did you want to maybe summarize a little bit about some of the comments you've gotten?
Yeah, so we actually even got a phone, thank you, John. We actually got an inquiry from the media as well, saying that
you're garbled. Can you get a little closer or something? I can hardly hear you. Try again.
Okay, well, is this better, Colonel Leaks?
That's a little better. Go ahead. Mm-hmm.
Okay.
Good.
Okay, thank you, sir. So, I not only saw some comments on social media, but a member of the press actually called saying that an anonymous driver called them saying that no one is social distancing on the buses, and a couple of other concerns that they had as well. And my response was that we have started requiring masks and we are allowing no standing. And when a bus gets to the point where it's seeing overcrowding, we're sending a tripper bus to follow it, so to allay some of that overcrowding. But I generally see comments periodically of people asking about social distancing on the buses.
So what kind of volume are you getting on that, Pam? Just an occasional one or pretty steady?
It's regular. It's not overwhelming. So I don't want you to get the impression that it's overwhelming, that every day we're getting bombarded by people saying this, but I would say we get maybe a couple of people a week that mention that. And I'm just raising the flag to say this may be something we need to look at. I don't know that we need to do anything right now, but just be aware that there is that sentiment. And I think my concern is if cases go up, would there be more of an outcry of people saying, well, I don't want to sit next to someone on the bus because I'm not social distanced?
Yeah.
Well, here's what I'm trying to think through is if there's any way. I mean, the only source of information that could tell us anything about the sources of infection or contact with positives that people who are testing positive would be through DHEC's contact tracing system, and I would expect them to alert us if they were finding that when they are following up on contacts that the contacts were made while riding transit. So we might just need to have some conversations to see if there's any way for us to get any signal that what we're doing is not protective enough of riders. It's hard to make that kind of call on without any kind of tracking or any kind of data to look at.
Sure.
So do you think we might just have those conversations with the folks at DHEC that are doing contact tracing to just say we want to be sure that if there's any indication in their tracing that people have been coming in contact with positives on the bus, we'd like to know that?
I think that's a good start to a conversation, and even we may even go further to see if we can find out if you're sitting next to someone with a mask on and you have a mask on, how likely is it to transmit the virus if either one of these people are carriers? And I think that would help us a lot to understand our path forward, as well as minimize concerns for people that feel that they may be at higher risk.
Well, and the thing is that we know that there's several things that can make a difference. That if you are both sitting and facing forward and have a mask on, that risk is probably pretty low. If you're turning and facing each other and talking with your mask on and you're in close proximity, there's some risk, but the mask still is a protector. But people, to a certain extent, can help with, even if you're talking to the person next to you, if you just stay facing forward, that helps.
Certainly.
Let me ask you a quick one now. Are these complaints or ideas coming from any particular sector of the service area? Like, particular routes, or is it just haphazardly anywhere?
What? Well,
Because I'm kind of wondering about the ridership. Which routes have ridership that would have a full bus versus some that are still running around, going with the not less than half or something.
so it's mostly busier, like 801, the 3-digit routes. Those are the ones that the people say that they are riding.
Well,
Which makes sense, because those would be the fullest, yeah.
Exactly. Yeah.
So maybe we might could do something a little different. I don't know. Routes that are loaded versus those that are not. Without doing the whole system. What do you think about that, John? Is that something you can look at?
RATP Dev on that. There will be an additional cost just because we're adding additional vehicles to the system, so we just need to be mindful of that. And also driver availability. But yes, we can look into that and report back at the next committee.
What the need looks like and what would be involved in terms of both cost of buses and drivers.
Correct.
Okay.
Because there are some. There's not really been huge consistency across the industry on this. There are some transit systems that are following the World Health Organization's rule of 3 feet. There are some that are following CDC of 6 feet, and there are some that are taking the approach that we've taken and just not allowing standees and blocking off the front of the bus, and in smaller buses blocking off the first row of seats closest to the driver.
Right. Well, I don't really think we have enough information to recommend any difference in action right now. But I do think this is something that we need to explore.
We need to study it, right? Because I don't want anybody getting closer than 6 feet to me under any circumstance. And if I want a bus, even at my house. But anyway, okay. Any other comments on that section, on that item?
No, sir.
Okay, well, thank you. Good report. So that leads us into item 4D, for Delta, which is a discussion of our SCDHEC partnership, pages 63 through 65. John, you want to take that, or whomever?
Actually, I would like Pam to take this one as well.
Okay. So can I kind of back up? Did we talk about the communications policy, John and Colonel Lee, Ms. Mood?
No, but you can include it as part of this because the DHEC kind of coincides with that revised communication policy.
Okay. All right. So in the revised communications policy, we made the edits based upon the last meeting, where you may see it highlighted in your document, where we took out the reference to passengers as far as notifying of positive, because that was something that we cannot control. We also added the portion that said that if somebody tests positive, they don't come back to work unless they test negative. And that was actually very timely, Ms. Mood. I believe that was one of the things that you brought up, because in that same media call, this anonymous person told the media newsroom that they were being made to come back to work, even tested positive. Now, I did research and found that to be untrue, and I relayed that thing to the media person. So we actually made sure that it was documented in the update. And then I think there's one other thing in there that we made.
It was making it public. It was making the positives public. Yeah.
Positive public, and also the list of having a link in any kind of communications that we have that points people to where they can go to get low cost, no cost testing.
Right.
Okay, which brings me into the DHEC.
All right, so hold on just a minute, Pam, Mr. Chair. May I just say something here about what she said so far?
Okay.
All
Go
right,
ahead.
so Pam, I know that you've issued a press release on a positive test, really applying these new parts of our communication policy. And I thought it was that press release was done very well, and I just was wondering if you'd gotten any feedback on that press release.
No.
Okay.
I have not gotten any direct feedback other than I had the state newspaper reach out to me for clarification of something that was in there, and they were really the only ones that I have seen that published it, other than some smaller publications. And there was no big hoopla or fanfare around that, which was a good thing. I do believe that the public is appreciative of the fact that we're transparent. Even though writing these releases gives me a angst.
I know it.
Of course, I want to make sure that we're all presented in a good light, and I don't want to alarm people, but I do recognize my responsibility to communicate the information to them. So,
well, I thought that you did that well, and also that it made real clear that our offering to the connections, that the links to resources for testing. I thought that was stated very well.
Thank you.
I agree.
Okay.
Thank you, Colonel Weeks and Ms. Mood. So, which brings me to the next point, the partnership that we've created with SCDHEC. John and I had a meeting with them earlier this week to talk about opportunities to partner to make known to our ridership and to the public that interfaces with us on where to get testing, and a FAQ and how-tos and different things like that. And I'm working with their communications team to get some posters to put on the buses and in Comet Central on how to access testing locations, sponsored through DHEC. And also we'll be partnering with them on social media to get the word out on our 3 major platforms, which are Facebook, LinkedIn, and Twitter. So that should be starting. I believe I get the posters midweek next week at the latest. And then those will go up as soon as I get them. And then we'll also be tagging and sharing via social.
Well, Mr. Chairman, I'm really very glad to hear this, because I think one thing is that kind of the posters and things will be helpful to our riders in terms of accessing testing when they want it. But I think it also will be helpful to DHEC's overall effort to get more people tested, because I've noticed that the demand for testing has dropped in recent days, and I don't think the need for testing has dropped. I think it's just the demand. So I think that might help both of us, and I'm glad to see that.
Very good. So am I. I agree. Okay. Anything else, Pam?
No, sir.
Okay. Anything from anybody else about anything this morning? I think we had a good informative meeting, and we don't have anything to take to the board other than just to give them an update on what we did look at.
I think the only thing that we just have to be specific would be just to report that we reviewed the policy that we've been operating under and consider it to still be valid for us to continue.
And look like it's working very well up to this point. So I appreciate that very much. Well, okay, if there are no other questions, then I'll ask for a motion to adjourn.
I so move.
And I second. Anybody objecting in this discussion? If not, the meeting is adjourned. We don't have to vote on
Thank
that, I
you.
don't think. The meeting is
Thank
adjourned.
you.
Bye-bye.
Thank you.
Thank you.
Bye-bye. All right.